everyone. So good to be back. Actually, seeing each other face to face after a whole year of not being able to do it this way. We're so appreciative of the fact we can come back just a little bit. We're still waiting on a few others to gather, but while we're waiting on them to arrive, we're going to go ahead and get the best part of our meeting, or part of the best part of our meeting, the food, taken care of. We don't want you to have to wait any longer. We know you all you didn't eat breakfast at all today waiting on us. And so we want you to at least get your breakfast in, and so you can listen to us real good and have a great time on this morning, our first meeting back after not being face-to-face for a little over a year. So with no further ado, we're going to have Ms. Sherrod bring grace, have prayer this morning for us over our meal and our meeting, and then we'll go from there.
Thank you, Dr. Epps. Good morning. Bow with me, please, if you will, or your custom. Most gracious Father, here we are again with thanksgiving in our hearts. Thanking you, Lord, for this day, a day we've never seen before. As we enter into this year of Thanksgiving, we give thanks. We ask this morning, Father, that you would continue to be a blessing all around Galena Park Independent School District, the community that we live in, and all of those that have entered the doors today. We ask that we thank you first for bringing them safely, and we ask that you would allow them to arrive back to their destination safely. Now, Father, we know you can and we know you will. We solicit healing, Father, for our land, and not just our land, but our world. We ask, Lord, for a cure for COVID. We pause today for those who lost the battle. We pause today for those who are going through the battle, and we pause today for those who have recuperated from this deadly disease. Father, we ask that you would continue to be in the midst as only you can. Now, Lord, food has been prepared for the nourishment of our bodies. We pray, Lord, that everyone that partake of it will enjoy it for the nourishment of their bodies. These blessings we ask in your rich and darling Son, Jesus' name. Amen.
All right, you all can begin serving. Get in that serving line back there with our lovely ladies who are going to help make sure you get plenty on your plate. So if you would go ahead and not all at once, we can go, yes. So they can get you guys served and we'll get our meeting started. Please enjoy yourselves. I believe back there we have eggs, bacon, biscuits, gravy, and it's all no calorie. So you should be okay today. And take it back to your area. Please feel free to do so as well. Let me ask first, are you enjoying your breakfast? Very good. I forgot to tell you about those sugar-free potatoes, too. They are so good. While you're starting your breakfast, I'm going to go ahead and bring a few things to your attention. And then here soon, Ms. Rayner is going to take over for us. First, I would like to extend condolences. Our SHAC president, Maria Juarez, she was prepped and ready to be here this morning, excited about seeing you all back face to face. And we got a call this morning that her father-in-law that lives with her passed away. And so we ask that you please keep her in your prayers, and that if you know Maria, please give her a call. She is such a lovely and amazing person, just takes care of everybody. And so she is definitely grieving this morning, and we definitely want to keep her lifted up and in our prayers. And we will also be reaching out to her and checking on her. But we just wanted to let you know that that is why you don't see her lovely, bubbly face here today, because she is taking care of her family duties, and we're so appreciative of her and are so sorry for her loss this morning. As you may notice, we have some new, if you haven't noticed, some new procedures in place with regard to how we're hosting our SHAC meeting. We now have to, thanks to TEA, they've sent us some new guidelines, and a part of what we have to do for SHAC now is we have to have a live stream. So make sure you're always real, cute. No, I'm just kidding. But you could potentially be a part of the live stream. So we do have others joining us for the meeting that are not here. And so that's an opportunity for us to reach more individuals. So we're really excited about that. But it was a little bit of a transition for us today, getting everything together. We have to ensure that we have our meeting posted, and we added our own little piece of new technology to it. When you received your invitation, you may have seen 2 QR codes, okay? If you do not know what a QR code is, you might want to grab your children or your grandchildren, because I had to grab my son when the first time I saw one. And you can use that QR code now. That's how you will sign up if you would like to attend face-to-face. Okay, so we have a face-to-face option and a live stream virtual option, and you can choose either. But if you do choose to attend face-to-face, because we are still working to limit those numbers, in order for us to keep up with that information, we do need you to sign in to let us know that you'll be here. So if you didn't use a QR code and you're here face-to-face, I'm not going to tell you to leave. We don't have to leave today, but in the future we need that, because if we get in and we go over our number, we would have to turn individuals away. So please make sure that you go home today and practice using the QR code if you've never used one before. And then the second QR code is there. The other QR code is there if you choose to live stream, and that was on your invitation that you received in the mail and online as well. The last piece that I want to say before we move on to the next item is that this is, in addition to being a wonderful fall and we're all getting ready for fall, we do know that October is Breast Cancer Awareness Month, and we definitely we would be remiss if we did not say and acknowledge our breast cancer survivors. This is definitely our pink month, and we wear pink to represent our support and acknowledgement of our survivors. And so as a small token of our acknowledgement, there is a brownie there on your table that you can take with you in honor. And we did that to make sure that we did represent those that are so beloved, that are either true survivors or that have passed away due to breast cancer. So we definitely wanted to make sure that we had acknowledged that part. Okay. Then the next part on our agenda, I apologize. Let me say this. In getting this meeting together, remember, we hadn't done this in over a year. So it was somewhat of a task for us, in addition to having the new pieces in place. And so I cannot move any further till I thank some very, very special people in the room, and some that are not here, for helping us get this together. If you would please come on in. Come on, grab your seat, grab your breakfast. You're fine. I want to first of all thank Teresa Rayner, our district lead nurse, who has worked with us very closely. I would like to thank, in her absence, Viviana Killian from our communications department and the amazing communications team under the leadership of Sharonda Hunter. They are amazing. They helped us get the live stream and the flyer and everything going, so please acknowledge them as well. We thank them. But you all know the real work is done by those people standing in the back of the room, who are often seen but kind of quiet, just stand in the background. They're the ones that make this room look so pretty. They get the invitations out to you. They take all the phone calls, all the last-minute changes. And so if you would please give them a rounding applause. My dear Secretary Melissa and her amazing team with Miss Elsa and Miss Floor sitting up here at the front translating for us as well. If you have ever had a secretary, Lord help, when they're not there, you find out real quickly who's in charge, who's the smartest one in the room, and what can actually be done. So we could not do this without them. And so, ladies, we definitely thank you from the bottom of our hearts for your being here today. So we're super excited, and thank you. And if I missed anybody, thank you again. Thank you, Ms. Sherrod, as well, for saying our prayer this morning, for bringing us grace this morning. I don't have an agenda in front of me, but is new business the next thing on the list? Very good, that's me. Okay, I get to stay up here. New business, you're going to hear a little bit more about Legacy today, and we're so excited about having Legacy in our district. As you know, we partnered together and they joined our team a little over a year ago when we opened up 2 school-based clinics here in the district, one at North Shore Senior High and one at Green Valley. Well, we were fortunate enough, they kind of liked us and we kind of liked them, and we liked the way each does business. And so now we have opened a 3rd clinic here in the district at the Galena Park Middle School campus. And we are so excited to now have 3 full functioning pediatric medical behavioral health clinics, not just in our district, but on our campuses. And that is absolutely amazing. And we're so glad to have that partnership, and just trust and know we are working on trying to find ways to get them in other places here in our district. As a point of reference and information to you, we are a district that is in support of the vaccine. We've always been pro-vaccine, not just for COVID. Ever since your children have been in school, we've been requiring you to get them vaccinated. And so with that being said, we're also encouraging COVID vaccine for our students and our staff. And at this time, as of last week, we offered the booster. Pfizer offers the booster, and we did offer that to our staff members. And we are closely watching the CDC and all the other agencies. And as soon as there is a booster available for Moderna and J&J, we will be working to bring that to the district as well, because we want things to be convenient for our parents and for our staff. We also have scheduled, as soon as it becomes available, the vaccine for children ages 5 to 11. And so once that is approved, we've already scheduled some dates here in the district. Texas Children's Hospital will be coming out to host our first clinic for our young people, and we are super duper excited about that opportunity. And I think that for now, that's all the new business I have. And at this time, I'm going to pass the microphone over to our district lead nurse, Teresa Rayner.
Good morning. Glad everyone was able to make it and enjoy this delicious breakfast. We do have 3 more meetings. This is a quarterly meeting that we have every year, and we have 3 more. They are on your agenda in your packet. December 8th, and make notice that it is a lunch meeting, so it'll be 11:30. And then we have February the 10th, 11:30, and Friday, April 1st. And that one will be at 11:30. So we want you to come out and enjoy that day and sign up, like Dr. Epps mentioned, on the QR code, so we'll know how many to plan for. And we have special guests here today to speak to us about where we are with COVID right now. So I want to introduce, and these 3 ladies are with our Legacy Clinic, our school-based clinics. We have Jennifer Dimaggio, nurse practitioner from the Green Valley Clinic, and we have Lorena Motu, a nurse practitioner from our new Galena Park Middle School Clinic, and we have Claire Rodriguez with Legacy Clinic also here with us, and they're going to speak now.
Can you hear me now? Okay. Can you hear me okay with my mask? That's what I was, okay, perfect. Good morning. Thank you so much for having us here. We're very excited to be here. My name is Lorena Motu. I'm a nurse practitioner at Galena Park Middle School, and this is Jennifer Dimaggio.
Good morning, everyone.
She is the nurse practitioner over at the Green Valley location. We're very excited to be here. And also, thank you for welcoming me back. I'm here again. You can't get rid of me so easily. But I've transitioned to a new role with Legacy. I completely love my students and patients that I've seen at Galena Park I.S.D, so I'm happy to continue to offer services with Legacy now as well. We're here to give you a little bit of information about our services and kind of what's been going on at some of our locations and how to get students to us, and also just to provide some COVID updates, because a lot has happened in the last almost 2 years now since all of this has happened with this pandemic. So we want to go ahead and make sure that we give you guys the appropriate information. So with Legacy Clinics, we have a special program that's called a school-based healthcare program. And the idea of this program is to offer affordable, high-quality care to students and their siblings while they're in school, or even on some days when we don't have school. There's some student holidays where we're available as well. We're very conveniently located at 3 campuses right now at Galena Park I.S.D. The first one is North Shore High School. We're at Green Valley Elementary, and then Galena Park Middle School as of this school year. We accept all kinds of Medicaid, CHIP, HMO, PPO, private insurance. If there's no insurance, please don't hesitate to reach out to us. We do put families in touch with an eligibility department to kind of help them find their way and navigate and see what they would qualify for. We are in other districts such as KIPP and Yes Prep, but we're very excited to offer these services in Galena Park as well. And also these slides will be available to you. We do have them in Spanish in case anyone needs to refer back to any information that may have been missed. Some of the services that we offer on campus include well child visits. So that includes the Texas Health Step visits, any Head Start visits that are recommended for them to continue to be in school, vaccinations, sports physicals. We are seeing sick patients, albeit we are being very safe about this and are doing curbside appointments for those students that may need to be seen because they are presenting with COVID-like symptoms, so we are being careful. We do help with managing asthma, getting action plans in order, weight follow-ups, education, senior checkout visits, which, definitely reach out to us if you have some seniors that are graduating this year so they can get everything in order, and COVID testing as well. We also offer behavioral health services, and our therapists offer a variety of treatment and therapy options for students that may be having a hard time dealing with anxiety, depression. Maybe there's been some difficult family issues that have come up. Obviously this year with COVID, it's affected a lot of families. So definitely reach out to us if there's any way that we can help and get you on board with some of these services. This is our general phone number if you want to jot that down. Somebody will answer this at all times. If you want to request a specific campus, you can request, if you live closer to North Shore, Galena Park Middle School, or you can just let them know what area and we can kind of coordinate what would be the closest way to get in touch with you. We are open Monday through Friday. Okay, so now kind of getting down to the nitty-gritty. I know we're completely overwhelmed with everything we've heard in the last 2 years, and we don't want to be redundant with some of the information. I think we all at this point know what COVID-19 is. We know it's affected us greatly in our nation with over 700,000 deaths in the U.S. alone. So it's definitely something that we want to continue to make sure that we're staying on top. There's so much information that's coming out on a daily basis, it can get a little overwhelming. So we want to hopefully make sure we can clarify some of the questions in reference to vaccinations, children and vaccinations, and maybe just debunking some of those myths or misconceptions that people may still have. So at the very end, if you have questions, feel free to ask. Okay. All right, so just to retouch. So we know that with COVID vaccines, with the COVID-19 infection, there are many people that are at risk. Both children and adults can get sick with COVID-19. So anyone can become infected. We do know still that certain populations are going to be at higher risk. So this is going to be our older adult population, anyone over 65 years of age, people with underlying medical conditions or any kind of immunosuppression. We've also learned now, though, especially with this last surge or wave of the Delta variant, that even unvaccinated individuals were a little bit more likely, actually 4.5 times more likely than people that have been vaccinated at this point to become infected. And this is some data that's kind of early come out from the last couple months. So as this last Delta surge kind of started hitting the end of July, going into August as we were starting the school year, we also know that those unvaccinated individuals that did end up hospitalized, they were 10 times more likely to be hospitalized than those that were not vaccinated. So again, the importance of getting your vaccine if you've not, or completing your series if you haven't. If you have specific questions at any point, personally, definitely reach out to your medical provider if you have specific questions. So this is a little bit of a busy slide, but it was kind of mashing up a little bit of what the difference is between how we move forward now if you're exposed. Because we know, even though if those of us that have been vaccinated, if you've been vaccinated, you can still get exposed to COVID, you can still get sick, you can still get COVID-19. But the idea of the vaccine, keep in mind, is to minimize some of these risks of anybody being hospitalized or having any serious complications from the illness itself. So again, this is just kind of to touch base on that. Of course, for any concerns about your student, reach out to your school nurse. We'll touch a little bit more about that later on in our presentation. But at any point, the main thing I kind of wanted to just relay here is, for someone that's unvaccinated, at any time if you're exposed or you think you have COVID, even if you're vaccinated, you want to make sure that you get tested, right? If you've been exposed to COVID-19 but have no symptoms, for people that are vaccinated, if they're positive at any time, you're going to isolate, right? And you're going to isolate for 10 days to kind of minimize that spread. But if you're negative and you're vaccinated and you're not having any symptoms, we're still going to be mindful if you start developing symptoms, but a quarantine is not necessarily recommended or required, really. You still kind of have to be mindful if you're out and working in public places or you're coming to school or things like that. And so that's just one of the things that we just wanted to share, that, with vaccinated or unvaccinated, you're going to be a little bit more greater risk of becoming ill if you're unvaccinated. So we want to make sure that we're mindful of that. At any time, if you're not feeling well and you're not sure, staying home, monitoring your symptoms, and reaching out to a healthcare provider. So where are we now, really? We talked about this a few months back, and so I feel like we were kind of doing okay for a little while. We were letting back and cutting some slack on some things and maybe some of our practices. But as it stands, as we recall, about a year ago or so, Judge Lena Hidalgo installed the Harris County meter, right? It's kind of like a meter that kind of helps us realize where our threat is right now for COVID. So we're still at a level 1. Even though we're here at a meeting, what that just means is that there are certain criteria that the county and the city is looking at together to make sure that we can come back down a level. So this is a combination of lots of things. So how many hospital beds are being used, how many new reported case COVID counts are, and what the total amount of cases. So it's a combination of those factors. I look at a few resources as a provider. There's a few places that we look at just so that we can kind of gauge what's going on in our local community as far as spread. And so some of this information is publicly available, but just so you know, that's kind of still where we're at. As far as vaccination rates, which we talked about this last time as well. So where we are from now, in the U.S., we're hovering right at about 56%. This is data as of last week, as far as people that are eligible to be vaccinated that are fully vaccinated. In Texas, we're almost at about 52%, so we're kind of getting there, and we'll go into why those percentages are important at some point for building herd immunity. And in Houston, we're about 54% fully vaccinated of those doses. Okay, so again, why are we looking at this? Because we know that if we have enough of our eligible population that's vaccinated, it builds a cushion of protection, right? So it's called herd immunity. And those herd immunity advantages come when vaccination rates are anywhere from 60 to 70%. So we kind of want to keep going, right? We know that those that are vaccinated also help protect themselves, help decrease our hospital bed counts so that we're not having so many people sick in the hospital. Obviously, there's other things that need to go and be seen emergently at the hospital. So that's why it was so worrisome with this last surge wanted to make sure that we could still attend to other emergencies that are still going on. So breaking it down a little bit more into our local community, this is a cumulative count of data for our immediate zip codes in Galena Park I.S.D. So as you can see, based on the population, and we just talked about there's been about 730,000 deaths in the U.S., but just in our communities alone, with these zip codes, there's 7702954 deaths since all of this started, 57 in the 77049 zip code, 69 in 77015, and 16 and 77547. So this may not sound like a huge number from the total U.S. count, but these are families that have been affected. These are children that are coming to school that have a grandfather or an uncle or a family member or someone that's been affected by COVID. So it is impacting our local community, and so we want to make sure that we're getting that message out and we're getting the message about the safety of getting vaccinated so that we can decrease, not add to any more of these numbers. So get vaccinated, right? So stay informed. There's lots of ways to get vaccinations now. As Dr. Epps just mentioned, they're already offering booster doses for their staff. I mean, you can go to H-E-B, Walgreens, CVS. There's so many resources available compared to where we were over a year and a half ago, and also compared to other countries. So definitely using those available resources as you can, whatever is easier for you. We do have a link here if you're interested in getting vaccinated through Legacy. We do have also family practice clinics that see adults. So if you've ever been a patient yourself, or for your students that may be interested in getting the vaccine, there is a link where they can sign up online, okay? I'm gonna give it over to Jennifer.
All right, good morning, everyone. I'm going to talk a little bit about the vaccines that are available to us. Some of you may or may not know about all of them. There are 3 that are approved by the CDC and the FDA. So Moderna is the first one. It's going to be Moderna, Pfizer, and then lastly the Johnson & Johnson vaccine. So Moderna, I'm going to touch on each one, this one is a 2-shot vaccine. It's 28 days apart, so about a month. It's approved only right now for adults, so 18 years and older. And then we have about a 94% effective rate. So when we say that, that means how effective this vaccine is to protect the population in kind of a real-world setting, not just in the early days of the clinical trials. The second one is the Pfizer, which you probably are familiar with. This is also a 2-shot vaccine, and it's 21 days apart, so a little bit closer, about 3 weeks. And the effectiveness rate is about 95%. And this is actually approved now ages 12 and up. So if you're an adult or your child 12 and up, they're eligible for this vaccine. And then the Johnson & Johnson vaccine, it's a 1-dose vaccine. The effectiveness rate has been proven a little bit lower than the other 2. It's about 66%. And this right now is approved for 18 years and up. So let me just mention again, we talked a little bit about the booster shot. I'm not sure if Lorena touched on that. It is now approved. Pfizer is approved for a 3rd additional dose. And this is for populations. I'm going to talk a little bit about the populations that they're recommending the booster shot for. Really, their FDA is recommending for people that have some type of immunocompromised condition. So when I say that, there are many examples, one being an autoimmune disorder, chronic heart disease, diabetes, someone that might have cancer or, having cancer treatment. I think the bottom line, the most important thing I can tell you is seek medical provider advice about that. So if you have a condition that you're concerned about, or about your child or about a family member, don't hesitate to reach out to a medical provider. They can give you better guidance. So touching on what Dr. Epps said, some additional news about the booster shot. The FDA, so Pfizer and all 3 of the vaccine manufacturers have put in all of their data to get all 3 vaccines authorized for an additional dose if you are qualified. So on the 26th, which I believe is next week, for pediatric authorization. Sorry, let me go back. They've already approved. They're approving for a 3rd additional dose for Pfizer, Moderna, and Johnson & Johnson. And really, they're again recommending that 3rd additional dose for those that have an immunocompromised condition, and as well as for 65 years and up, or high risk, right? Again, I want to go back to just, contacting your doctor. Again, touching on, I think what we mentioned earlier about, I sort of touched on that, was the children. I'm going to go into that in a minute. So we're gonna talk about that in a few slides. But what to expect after getting the COVID-19 vaccine. So how many of you have heard about side effects? Raise your hand if you've heard about side effects of a vaccine. Okay, it's a very common question that I've gotten actually from people when I've worked at the COVID-19 vaccine clinics. Will I have a side effect? Will I get fever? And the answer is it's very possible. It is a normal response. Anywhere from getting soreness or pain to the site where you've gotten the vaccine, or even systemic symptoms, fever, chills, tiredness, headaches, body aches. All those can basically is your immune response positively responding to that vaccine. So be reassured, those are common, and you can actually educate, your patient populations, your families that is actually a normal response. Some tips about how we're going to reduce that. Taking ibuprofen or Tylenol is something you can do. Applying a cold compress to the site if you do have some swelling or pain, as well as just common sense things like drinking water, getting plenty of rest after your vaccine, particularly maybe after that second shot that you get. I've actually heard more people complaining about the side effects after the second vaccine, and just doing those common things, getting rest. Now, if you do have a more severe side effect, and those more severe side effects maybe being like an allergic reaction, we always strongly encourage you to contact your doctor, or go to the emergency room if you're that concerned. But those again are very rare. So, touching on the CDC and, the FDA and children and vaccine, the COVID-19 vaccines. So the CDC is recommending that children 12 and up get it. And actually the American Academy of Pediatrics, which is sort of the utmost authority on children and medicine, recommend that if they're eligible, that they should get it. It's considered a life-saving vaccine, even for children. Pfizer is actually filed for emergency use authorization to the FDA for the COVID-19 vaccine to be given to children's ages 5 through 11. And I believe what I was touching on earlier, next week they're going to actually go to the advisory council and either approve it or not approve it.
So the advisory committee, sorry, can I jump in?
Yeah, go ahead.
So the advisory, so this was actually as of about a week and a half ago, Pfizer filed all their, data with the FDA. So what happens next is there's a council that sits and looks at all the data, this committee, right? And so they will have the actual word on October 26th is when they meet, which is next week. So we should be hearing soon as far as when this vaccine is available, when you can go to your provider's office. Back to Jennifer. So.
Yeah, so they're going to let us know. So I think just keep your ears and eyes open for next week because they're going to give us more information on that. Again, the third booster has been approved for Pfizer, for Moderna, and for Johnson & Johnson, okay? So again, contact your doctor if you're interested in that third booster and if you're qualified for that. Go to the next slide. So protecting your children. So protecting the younger children, actually all of our children. It's really important. We want to emphasize getting that one wellness exam every year. The wellness exam, when we talk about that, that's our checkups. That's really when we're not just looking at vaccines, we're also looking at growth and development, how they're eating, are they eating healthy, do they have any behavior concerns that a parent might be worried about, behavior concerns from the school, are they learning and developing appropriately? We touch on all that, so that's something I recommend every child get once a year. As well as also just child hygiene practices. We want to make sure they're washing their hands, that they're covering their mouths, they're masking appropriately. Those are all still important. Encouraging a healthy lifestyle, making sure they're sleeping, making sure they're eating healthy, and then also staying active. Getting them from looking at their screens and going outdoors and moving their bodies. Those are all important. And then we just recommend that if your child is sick, monitor those symptoms, follow up with a healthcare provider if you have concerns. And if they are sick, we recommend having the child stay at home. So now we're going to go to the school's protocol, the Galena Park protocol. First of all, where do we get tested? So I'm going back to COVID-19 testing. So there's a couple of sites. A lot of you may know this already. If you've probably seen the signs in the front, you can get rapid testing here at the admin building. We do recommend that there is a link you can go to actually schedule that appointment. We can give you more information on that. And then, of course, our legacy clinics, you want to call that phone number, the 281-628 number, to get an appointment. And we're testing kids at the Green Valley site, the North Shore High School, and the Galena Park Middle School site. And then, of course, there's others. If you can't get in there, the readyharris.org link is available, as well as the Houston Health Department link there as well. And if you have any questions about how to get tested, always contact us. We're free to give that information if you can't get in to see us. So some exclusion criteria information. I know you might have some questions as a parent, like what do I do if my kids have symptoms? I'm concerned. And we're really recommending the first thing you do if they have symptoms and you're concerned is calling your school nurse. We have that protocol in place, and those school nurses know that protocol. They've been trained by Miss Teresa Rayner here, and they know that information. So please go to them, contact them, see what kind of guidance you need for that if they are symptomatic. And then, of course, we just want to reiterate, if they are positive for COVID-19 but don't have symptoms or they're asymptomatic, they really do still need to stay home. And we're recommending that 10 days after the day they were tested. And then again, if you're more interested in more of those protocols, there are a lot, more of them and more information. Please contact or even go to the website. So the Galena Park website has all of that information. And then I think we're going to talk about debunking some myths, and I think Lorena's had those first two.
Yeah. Okay, so we're going to do a raise of hands, if that's okay. I thought about bringing our little, truth, false kind of thing that you can hold, but we're going to go with the first one. So the COVID-19 vaccine causes infertility and irregular hormones. Raise your hand if you'd like. You can do it kind of discreetly if you think this is true. Don't look behind you. Okay. Raise your hand if you think this is false. Okay. All right. So this was an important one. These are common questions that have come up in clinic. I'm so sorry. And so I wanted to make sure that we address them. This is a very common one that's come up with sometimes my parents will ask in clinic that have not been vaccinated, and some of my parents of an adolescent that's a female, that has a female adolescent that's coming to the clinic. So right now the guidance states that we can vaccinate without a concern at this point for any cause of infertility or irregular hormones. There are several, keep in mind, there's several vaccines that our children receive, okay? And so far, none of these other vaccines have caused irregular fertility or hormones or cycles. I know that questions come up on those, so definitely reach out to us if you still have questions. But some of the main providers that are specialists in this area, so this is the Pediatric Adolescent Gynecology Society of North America, the American Academy of Gynecologists, have both given out supporting statements for this vaccine, debunking the fact that this would cause any kind of fertility concerns. Now, we also know just from some reports, even though there are some reports of irregular cycle skip periods, prolonged periods, has happened with not only if it's reported around the time of vaccine, but also with COVID-19, because we know that sometimes when we're ill, right, when we're sick, when our immune system's thrown off, and I talk to young ladies all the time, and even at work, and when we're in clinic, other things can cause our cycles to become irregular too. Your weight went up, your weight went down, you're stressed out, other hormone imbalances. So there's other reasons. But it's not enough data to support that getting the vaccine will cause any kind of fertility issues. Okay. Second one. So the COVID-19 vaccine changes my DNA. Raise your hand if you think this is true. Raise your hand if you think this is false. Got an intelligent group here. You guys are great. So no, this does not alter our DNA at all. As a matter of fact, the vaccine proteins basically don't even enter the most inside of the cell. So there's no way that it could alter your DNA. That's the simplest way that I could explain it. So there's no concern about that or any kind of chips or anything else being implanted in us. So I just wanted to make sure that that was definitely out there. The third question, the COVID vaccine will give you COVID-19. Raise your hands if you think this is true. Raise your hands if you think this is false. Okay. So maybe that was a little tricky. So the same question actually comes up with the flu vaccine, I feel like every year. So getting the vaccine, it's not an active form of the virus that you're getting. So it does not give you vaccine. Now, there may be a reason that you could get COVID-19. Let's say you got vaccinated today, and then 3 days later, you have let's say a day later, you had low-grade temps. Okay, it could have been a vaccine side effect. Okay, let's say, well, you go get tested. You test positive. There is a likelihood you could have been exposed to COVID somewhere around the time that you got the vaccine. The same thing happens with the flu vaccine, and I explain that to my families all the time that are sometimes a little hesitant. We get the flu vaccine around the fall when it's like peak cold and flu season, right? And so there's definitely that probability of getting sick from something else or other viral infections, but it will not actively give you COVID-19. Okay.
All right. So third statement, the COVID-19 vaccine will give you COVID-19 virus.
No, the next one.
Oh, wait, sorry. I'm sorry, the
COVID-19 vaccine causes.
oh, did you already do this one?
I did.
Okay. Oh, sorry, no, it's okay.
I did agree, I'm sorry.
I'm like in my head here. The COVID-19 vaccine causes long-term side effects. Raise your hand if you think that's true. Raise your hand if you think that's false. All right, so that is correct. So the way vaccines have been monitored in the past and the same way as now, they've seen that if there is going to be a side effect, it will happen within 6 weeks of getting the vaccine. And the COVID-19 vaccine, this is not just for vaccines that have been studied with COVID-19, but also before. They are studied much longer than that. So really, they have not seen, with all of we've seen millions of people be vaccinated with COVID-19, we've not observed long-term of side effects. So again, a false statement. Okay, and then the last one, I can stop wearing my mask after receiving the COVID-19 vaccine. Is that true or is that false? Raise your hand if true. And raise your hand if false. All right. Yeah. Yeah. So we're still at risk. And I think Lorraine mentioned that before. Even when you get the COVID-19 vaccine, you're still at risk of getting COVID-19. So really the mask is still doing its job. It's minimizing the risk of you spreading it and actually receiving it. And again, so that's a false statement. You really do need to wear that mask. Even though we're tired of wearing masks, I think we're all exhausted of it. It's still really important.
And I think we'll get there eventually, just to end on a positive note. Yeah. Once our herd immunity has gone up, our cases have decreased, more people are getting vaccinated, all those things we need to take into consideration to go back to what we recall, being maskless. I just wanted to make just a quick note, there's other guidance that the CDC has advised also. Like there's individuals that are vaccinated that are going to get together. Yeah. You can in some instances, be unmasked. Now, if there's someone there outside of your bubble, you're not normally like living with them, you still want to keep some of these safety practices in place. I know that gets a little concerning and worrisome. I know with the holidays around the corner, so just continue to be mindful, doing your best to try to stay safe. And we will get through this. We've gotten through this so far the last almost 2 years. Yeah. So thank you so much for your time. If you have any questions that you feel we maybe did not address, or there's other concerns, please let us know. Reach out to us. Does anybody have any questions right now? Yes, ma'am.
Yeah. How come sometimes it's 10 days to,
the quarantine?
And then sometimes it's 14?
Yeah, that's a good question. I feel like that causes some confusion. The general consensus, if you look on the CDC's recommendations, is the 10 days, because we know if you're positive, because we know that as the end of that 10 days occurs, your viral load is going to be less. So there's less chance of spreading the illness. So you're going to be more contagious. And this is the same with many other illnesses, like when you have a cold too. You're going to be more contagious, usually at some point earlier on in your infection, especially with COVID-19. So right now they just kind of landed on the 10. There are some special considerations with guidance of your provider that you can discuss for earlier than that. For people that, I know in last year when we were waiting to see if you developed any other symptoms, if you've been exposed, it can happen up to 14 days. I think the data's kind of out there that maybe not so often on that last, but it's a possibility. So you should still be mindful at any time, just because you don't know if you're exposed, if you're anywhere unmasked for a long period of time or in a high, crowded area. Any other questions? No? Okay. Thank you so much.
Thank you, guys.
Thank you to Ms. Dimaggio and Ms. Motu. One more round of applause, please. Thank you. Now we're going to go to the minutes. You should have a copy in your folder. If you take a moment to go ahead and look over the minutes so we can make a motion for those. So I have them on the screen also. And this will be for our minutes from Thursday, April the 1st, 2021, for our SHAC meeting that we did via Zoom. Do I have a motion to, are there any corrections that need to be made? Okay. Do I have a motion to approve the minutes as presented? State your name, please. Yes. Okay, we have first motion. Do I have a second? Linda Sherrod. Thank you very much. So the minutes are approved for the April 1st, 2021 SHAC meeting. Do we have any questions or comments from this meeting, or any questions for anyone? Any comments? Okay. We do want to remind you to complete the sign-in sheet that's in your going around the tables, and also complete the survey. And I do want to mention again that we have, yes ma'am.
Hi everyone, it's good to be here in person and see people in real life. My name is Cara. I'm from Harris County Public Health, and I work for a program called Healthy Living Matters. And I just wanted to invite anybody that is interested. We're having a SHAC convening, and we did this in the past before COVID, and it was in person, so we were only allowed 2 people to attend. But since it's virtual for this time, if anybody is interested and wants to network with different SHACs in our area and also get additional resources and things like that, I invite anybody that's interested to come. and I can share that information with Dr. Epps and Ms. Rayner. And it is on November 18th from 9 a.m. to 11 a.m., and it's virtual. So if anyone's interested, feel free. That's basically all I have to say.
Thank you, Ms. Appidigo. Any other comments? Okay. I do just want to remind everyone, this is October is Breast Cancer Awareness Month. I do know that in our district, we've had the Rose Mammogram mobile van go around. And I did find out yesterday they do have 4 vans now. So that's pretty awesome. And when you go and make your appointment, part of your money goes to help others that don't have insurance or any other capable means to go get their exam. And we know how important that is. Also, this is Dental Hygiene Month. So when you start trick-or-treating or go out and get your candy, just remember to brush your teeth. And let's see. Again, we've been having the booster vaccines. We've had different locations for those. We'll have more coming up, so watch the internet, the website, Galena Park I.S.D. website for that. And we just want to thank you again for coming, and we want to see you in December. And just have a good week, and see you again in December, if no other questions. Thank you. Yes, and please take your homemade brownie home. Yes. Thank you very much.